Yeah.
Whenever you want.
Okay, so even before I do anything, do you want to take her through something to see if you can image anything?
Yeah. Let's let me have you put your chin up. Draw up just a little. Here we go. Go ahead and go.
Oh yeah, your arytenoid's effed up. Good job.
Take me through a pitch glide.
So Sarah, what do you see?
So we definitely have some decreased movement of the left true vocal fold and the left arytenoid, with some compensation over midline with the right arytenoid, kind of creating that crisscross kind of pattern
There
again.
was quite a bit of crossing midline at that. Yeah.
Yep.
All right. So primarily what I'm going to be doing is what we did already this morning, what we're going to do next, and what we're going to finish the day with. Okay. So and as I work my way up that right wall, and that's imaged on the left, correct?
Yeah, so it's opposite. So closest to us would be her right side, closest to the door is her left.
Right, so here I go, working my way up and down on the right side, what you might view as the non-affected side, correct? Now let's go in on that left side, and boy, that's kind of lumpy, grumpy right there. Is that relatable at all? Mm-hmm. Yeah. Like right in through here. Now, can I fix a paralyzed vocal fold? Absolutely not, right? But is a person's dysfunction solely 100% a result of that, or are there secondary aspects that we can impact with manual therapy, exercise, other interventions? What I'm doing now is what we're going to be doing next. I've come in under the SCMs, and I'm putting pressure. Can you get a better view on that at all?
What would you like?
A little bit over the top of the epical. There we go. Yep, good. And now I'm putting equal pressure on both sides, and I'm coming in behind the thyroid cartilage. Now, if you can watch for a moment, I'm going to get my fingernails under the thyroid cartilage, right there.
Ooh.
On.
So that's a hyoid.
It's close your ears for a second, will you? Amy? It's a mangled mess in there, huh? Yeah, but lots of asymmetry. But lots of asymmetry may not correlate to lots of dysfunction, right? How about right up in here?
Is that your finger on the right?
Upper left side? No. No.
That's the hyoid.
My right.
Yeah, right there.
No, it looks like my finger, but it better not be. What is that? That's the hyoid. That would be the right side of the back of the hyoid right there that I'm playing with on the right in there. And then, boy, you know, we don't see the hyoid in the same way when I do my left hand, your right side, right? You just see a big wall coming over. Now what I want to do is go back to your issue. Am I at all connecting with your issue?
Oh yeah.
Where?
My left side.
Your left side. Can you maybe even put a hand over mine to show me what part of that hand is giving you? You mean, is it that?
All of it.
All of it. Okay.
Yeah, when you first started going in, it was very tender.
Yeah.
But yeah, I mean, I feel like it's a little bit tender, but a lot of stretch.
Yeah. I definitely could see how you could use the fees as a before and after, right? In terms of seeing what's going on, doing some treatment, and then go back for a retest. I'm just thinking along the lines of what we saw in Buffalo. I told you about that yesterday, right? Is there a way to make these two part of both evaluation and treatment? And I'm not quite sure. But I think as you, now there we got a nice equal view. Go ahead and speak or test yourself with your range. And I'm not doing anything right now. That's just her. Okay. Now, go ahead.
Can you tip your chin up for me? And then go through those ahs again. Once more.
So the crossing midline movement of the right arytenoid, what do you relate that to?
I mean, I don't feel anything.
Yeah, I'm kind of canvassing the group. What does that mean to you? Does it?
Crossing over the right.
the crossing of the right over to the left, which is opposite, right? It's
Right,
the-
so it's
yeah,
overcompensating.
It's a hyperfunction.
Yeah.
got it, all right.
Hyperfunction, yeah.
I also comment too, like, I've noticed, like, there's more flexibility in movement when you move now, that I have to make more adjustments
Ah.
to
Oh.
anticipate kind of your movements.
Can you say that a little louder?
Yeah, so I've noticed here that just in this few minutes, she seems to have more maneuverability, so I'm having to do more micro adjustments to kind of keep an image for you guys.
Oh.
So it's just interesting observation.
I'm still looking for things that feel like crud pockets to me. I'm still looking for that stuff. And I don't want you to discourage yourself from doing that. Be nosy, be curious. But then once you feel or find something, temper it. It's like, say to yourself, all right, that on your side, Amy, on the right feels tight to me, but is that impactful at all to you, right there?
It's more tender, right where you are now, yeah.
Right there, yeah.
Yeah, more than anywhere else you've touched.
Okay, it's
On the
tender,
right.
but is it relatable?
No.
No, it's just crud. So, but if I go back to the left, her problem side,
Yeah.
there's that same spot right there. That, does that doorbell ring something to you?
Yeah, very much so.
Is this part of what you're talking about?
Yes.
Go ahead and say something now. Can you get down? Yeah, there we go, okay. What I'd love to see is if we can get more action on her left side before we finish up here, right there.
Yeah.
Now, you're not able to see the thyroid cartilage itself really well here, but I'm behind the thyroid cartilage, picture that, right? In front of the spine, behind the thyroid cartilage, and I'm ever so gently, this sounds odd, but prying my fingers under it and pulling the thyroid cartilage forward. Do you feel any of that, Amy?
I can feel that forward.
Yeah, the anterior displacement of the whole larynx, really. I want to do what we're going to finally do later, and that is, I'm going to come in, is it okay if I put a hand on your chest?
Yes.
Okay, got it. So I want to come up really high, up just below the thyroid notch, above the sternal notch, below the thyroid notch, and I'm going to do a downward drag. I'm basically anchoring the larynx downward when I do this. And as I do this, Amy, what do you feel?
A stretch here.
Okay, but what about your voice issue? What about the fatigue?
I just feel anchored.
I'm minimizing her ability to raise her larynx, right? If she went into a swallow, often it's very uncomfortable. We're all going to
Yeah.
do this a little later today. Does this feel impactful at all?
No.
No. So I would come back to what we were doing earlier.
So-
Whether it's that, go ahead.
So interesting to me, I don't know if you guys see it too, but even though she says it doesn't feel impactful, there's more, it's not completely symmetric, but it's more synchronous movement between her arytenoids when she
You
was
mean
having
when I
that.
do that, or when I took the
Oh,
pressure
very
away?
much so.
When you had it anchored, when she was having that anchored feeling.
E, e, e.
Can you do a glide up?
E.
Do you find that challenging because I'm resisting that?
Yes.
Yeah.
E.
When we do this anchoring later today, most of you will feel it a lot more pronounced with swallowing than you will with elevated pitch, okay? But it's still, I mean, the same concept, but you can overcome it more with the pitch glide than you can with the swallow. What if I went to where we were earlier? Now, that had an immediate impact on the arytenoids. When I came up and under, this was sort of that second portion of when we were at the base of the tongue, compressing. And as if I reach down, elevate the entire larynx via the submental region, right there. Does this feel useful at all?
A little bit.
A little bit, got it. So we would go back, where would I spend my time? In the places that she felt connected to, all right? Okay, is there anything anybody wants to ask before we pull this out?
Yes. Can she do a breath hold for me? Okay. Cool beans.
Now, is there anything you want her to do before you pull out to see if you can notice any change?
Yes, I'm not moving. I have aberrant movement of my arytenoids too.
Yeah, that's interesting. Can you do the he?
He.
Right, so we can create some movement over there. How about counting? You can pick 60s or the 80s.
60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70.
So there's something over here on the right that interests me, that she's not connecting to, but we're seeing all that overcompensation on her right. This is where from a shared decision-making perspective, I might take something back and say, okay, you can't relate to this, but can you give me a few minutes to see if I can feel something in here, like right there?
Yeah, that feels like a stretch. I connect to that.
Yeah, because I'm curious if input to the over-functional side may have an impact instead of working at the poorly functioning side, right? I'm just throwing this out there in the way that it doesn't
right
have.
there.
What's that?
Right where you just were.
Right there?
Is very tender.
Right there? Tender, though, just because I'm poking your heart, or tender that you can relate to?
No, tender that I can relate to.
Got it. So, you see what I mean about shared decision-making? I have my thoughts, you have your suspicions. Don't immediately abandon them because they don't instantly validate them. The decisions are being shared. It's give and take all the way, okay?